The most common cause of dental pain is the pulpitis, which is where what people call the nerve of the tooth becomes inflamed. It's enclosed inside a tooth, and so it can't really swell, and that's what causes the grief. So if there is no swelling, antibiotics are of little value. The best painkillers are normally Nurofen, taken alongside paracetamol. There are other painkillers available, but generally these are regarded as the best. Discuss with your chemist. Take them if you're able to do so. The current concerns about Nurofen and the virus no longer seem applicable. You wouldn't take antibiotics for a sprained ankle, and your teeth are no different. The discomfort is likely to last 2 or 3 days, but the analgesics will help reduce the discomfort a lot. And as with all pain, it's often worse when you're tired and run down. The best thing you can do, or rather a more useful thing you can do, is just distract yourself, or if it's your child, distract your child in a manner that helps them focus on something different. And this is further advice from a very good resource. Either pause the page or go to the website.